Hi, welcome back to Unfiltered Mommyverse. We are
Chris.
and Jules.
So today we are joined by Dr. Jennifer Lincoln, board certificate OB-GYN and author of the birth book. We have it here to talk about something that so many women experience, but honestly don't always feel like fully prepared for, right? Like birth, motherhood, and all the information and let's say misinformation that comes with it. So, Dr. Lincoln, we're very glad to have you here.
Thanks for having me. I'm so excited.
So, would you like to start, to tell us a bit of yourself and how you ended where you are right now?
Yeah, so I went to med school and did my OB-GYN rotation and just loved it. And I was doing my rotation in Texas, which I went to med school in New Orleans, Louisiana, but we had a little hurricane called Hurricane Katrina during that time. And so we had to evacuate. And so we ended up moving our med school to Houston, Texas. And it was such a big complex. They absorbed us. I felt like they could have absorbed a whole nother school. And it was there that I did my OB rotation and I just loved it. And I thought if I could love something like this when I feel like my life is so out of control, then maybe I should do this. And I loved the mix of what my field brings, that you can do obstetrics, gynecology, you can change your career over time, and you can also integrate real education and advocacy and just feel like you're helping women. And I ended up doing my training in Portland, Oregon, and I now work as an OB hospitalist. So I work on labor and delivery. I don't have an office practice anymore. And I educate on social media because I saw a lot of stuff out there that wasn't so great. And then I saw other people who were also educating, and I thought, oh, I'd love to do this too. Then I wrote my first book, which was it was called Let's Talk About Down There, which was about basically everything that everybody ever asked me on TikTok about periods, sex, birth control, going to the doctor. And then I wrote this book, the birth book, after I saw that patients were coming in just having no idea, feeling that they didn't have time to ask questions in the office and were extra confused because what they did see on TikTok or Instagram might not have been the most reliable information. So I wanted to give them a resource. And it's the first book written about by an OB-GYN that just focuses on labor and birth, not including pregnancy as well. So it's been fun.
That's a wonderful journey, Dr. Lincoln. And I want to say this book is amazing. And I wish I had it, that it was out when I was giving birth over 5 years ago, because it's full of such a important information here. And you also
Thank
talk in this
you.
book, you're very welcome. You talk in this book about the both necessity and overuse of C-section. And to be honest, in Germany, back in the day when I was giving a birth, I had the option. Do I want a C-section or I want a natural vaginal birth? And can you tell us from your perspective, from the doctor perspective, should a future mother have that choice, or the lines being like
Yeah,
crossed? There's very thin line.
it's so interesting. So you were just like everybody gets offered just
Not
C-section or
offer, but
vaginal
you
birth
can
or
opt. You can go to the gynecologist. You can say, I have a fear, or I can't get the, I don't know, I'm just afraid of vaginal birth. Can I have a C-section? And they cannot say no to you. At least back then.
yeah, that's so interesting. So here in the US, about 1 in 3 of our births are cesarean births, and our goal is to lower that rate because we know it's a surgery. However, I think it's important that if folks have a concern, like you mentioned, like they have a true fear of labor or there are other concerns, that be a discussion. And I cover it in a section about, it's called cesarean delivery on maternal request, which is basically you're asking for it. It's not that there's a medical reason. Yeah. But I think that it's really important that we never say that should always happen or it should never happen, but it should be a discussion. And then for some people, it's absolutely going to be the right choice. And then for others, they might have had a fear, like maybe they saw something, or you know how friends and family members love to tell you all the things when you're pregnant and you're like, this is not helpful. But if you address it and say, actually, what they said wasn't true, and here's the story, and if you can get to the root of that fear, then that person who may have previously wanted a C-section doesn't want it. So I think it's important. It's not like, you're asked that and it just happens in the United States, but it should be a discussion. And I think that it can be a tool that can be really helpful for the right person, but we just want to make sure we're not doing them without figuring out why, if that makes sense.
Mm-hmm. It was definitely said to me, like, because I was opting more towards the C-section because I was really afraid. But they were convincing me, like, you can do it. It's gonna be better for you, for the child. And I went to the natural birth, but it was very traumatic. So I was thinking, like, maybe I should have stick to my previous decision. Yeah.
Yeah, and that's why I think it's so individualized, right? Like
Yeah.
somebody might have had that and been like, it was great. And then others are like, I didn't really have a choice. And it also takes into account how many kids do you want? What are your thoughts? And so I think it's so important that we, just like so much in medicine, you don't have a blanket rule. It's you take the time to really to chat and that somebody feels like they're not getting pushed or coerced into something they might not want.
Yeah, that's true. Like, for example, in here, like, you don't get that option from the doctor, like, what you want to do. But as Jules say, like, if you ask for it, maybe they're gonna try to convince you as well, like, to go for natural birth and. But yeah, there is that chance as well. Like, I don't know. For me, like, I just had a normal, like, a vaginal birth. Like, I wanted to address that you talk about many unmedicated options for when you give birth, right? And then one of them, most important ones, I believe, like, most of the people have, is that someone support beside you when you are giving birth. That gives you the strength as well to have it. My own experience was, like, I have 2 kids. The first one, I had it in Ireland, and the second one, I had it here in Spain. Okay, so I had, like, 2 but very similar experiences. I used the gas with both of them. Like, I think it's called, like, the Entonox. Well, they have the Entonox in there. Yeah, it's a mix with oxygen, right? And for me, like, I felt like I was in control of the situation because I could do it whenever I feel like. But maybe it wasn't like that, but it was like, it helps you, or at least it helped me cope with the contractions which was coming.
Right.
But it was very important as well, like, to have my husband there, like, saying all the time, like, you can do this, you can do that, like, and everybody was like, are you sure you don't want the epidural? Like, and I'm like, no, it's fine. I want to try,
You're like, don't keep asking me when I'm doing fine. Like, I'll let you know. I know.
Yeah.
But what you mentioned is right. Oh, go ahead. Yeah.
No. Tell me.
No, I was going to say, you're so right that support makes a huge difference. And we have data to show that when you're supported continuously in labor, not just your doctor or your nurse coming in and out, but like somebody's there with you through each contraction, you are less likely to need pain medication because you've got somebody who's cheering you on, who's not like, wow, this looks really bad. Don't you want an epidural? And I think that that's really, because it is a team sport. And when you think about how we give birth, only in recent history has it been done in hospitals, which is a whole probably separate conversation. But we used to give birth with people around us, right? Like our family, maybe our partners' families. Like, it was supported. It was also normalized. Like, the first birth you didn't show up to wasn't your own. You had been present. And so that unknown of what is normal can be really scary too and change your pain perception. And what you mentioned about using the nitrous oxide or the gas and air, what I love is that, like, this was what's old is new again. So in the United States, when I was in residency, we didn't have that. And it just a few years ago, we started getting it back in the hospital. And it's funny because, we are uncomfortable. How do we use it? Is it safe? And in the UK and everywhere, they've used it forever. And now we all feel comfortable. But it's cool to see this option that is so patient driven. Like, you put the mask on or you put it in your mouth, you take it away. Like, you're in control, and for some people it works great. Others are like, no, I still want the epidural, whatever, but it works as this bridge. And it's just nice to have more choices. But I think the key of having somebody there and who's helpful, who's not just like in the corner. It's important.
Totally.
Yeah.
Like, because I was all the time like, I can't do it anymore, and he was like, yeah, you can do it, you're doing great, like having that all the time. But what I wanted to ask you is, like, you think, like, the fact that we have more options actually reduces the anxiety, or like that make us a bit like feel overwhelmed and we don't know what to choose?
I don't think it makes people feel overwhelmed. So seeing that we just introduced nitrous oxide a few years ago, seeing another option, I think actually makes people feel like they're not so afraid. that they don't have to jump right to the epidural. Like it's nothing or it's the epidural, that they can have IV pain medication, they can have nitrous oxide, they can get in the tub or the shower or use a TENS, like the electrical stimulator unit. And I think it helps people. I think in a perfect world, people have heard of these options before they show up, because it's really hard to make a choice when you haven't heard about it and you're now in like so much pain. Or worse yet, you're like, this is what I'm going to do. I'm going to use nitrous. And you get to the hospital and they're like, we don't have that. So to not have had that discussion, that's why it's so important to discuss these things at your prenatal visit. So you don't show up and you're like, wait, what do you mean there's no tub? Like I was going to labor in the tub, that's when people, I think, really feel overwhelmed and like the plans fall apart, which is hard.
Yeah. And with all the options that women have, would you just give us the top pros and cons between all of them?
For pain control?
Yes. Between epidural, unmedicated, the oxygen.
Yeah. So fully unmedicated is what it sounds like. You're not using anything pharmacologic, but what I tell people is it doesn't mean you're alone in your suffering. And I'll mention the non-drug options for pain control, such as getting in the shower, massage, position changes, using the birthing ball, the electronic stimulator, the TENS unit. There's also sterile water injections, which I write about in my book, but I've never seen them done. And I don't know if you have, or it's more common there, but it's what it sounds like, little water injections in your low back, and they hurt like hell, I've heard. But what they do is you focus on that and it kind of takes away the pain. Oh, and it only hurts like when they're doing it. It doesn't hurt forever. But the point is that it kind of overwhelms the nerve receptors that would then your brain would process as contraction pain, which I think is pretty cool. And laboring in the tub, I don't know if I said that already. And then moving up, there's nitrous oxide, which we talked about, which is where you breathe in this mix of nitrous oxide and oxygen. And it's really, what's awesome about it is that it's quick on, quick off. So you can use it your entire birth, even up to your baby coming out, because it metabolizes so quickly. And I tell people it doesn't take the pain away. You just care about it less. It makes you less anxious about it. And for some people, it can work great for labor, but you can also use it for like procedures in the office too. And then IV pain medication, what we use at my hospital and a lot of hospitals is IV fentanyl, but other places will use other things. So basically it's IV pain medicine that can work really well. It's like having a few margaritas, but it can last a bit in your system. And so we tend to not use it right at the end of labor, because then your baby can also come out feeling like they've had a margarita and they might not want to breathe and cry as much. And then lastly, the epidural, which I think most people are familiar with, but it is a numbing injection in your back. There's a catheter left in, so it's not like it runs out, it runs continuously. And it can take away all your pain completely or a lot of it. You may still feel a bit of pain, especially as that baby's head is coming out. You may feel pressure, but there's doses that we can go up or down. And, they all have pros and cons. And I think it's important just to figure out what feels like is acceptable to you. But there's no like one right or wrong way to do it.
And how common is it that the epidural will not work? Because I had it done twice, and the first time it did not work. They asked me to bend, and I couldn't bend with the belly.
Right.
So the second time they did it when I was laying down, and I had it just for 30 minutes, because then, okay, we have to cut it off because now you have to start pushing. So.
Oh man. Oh, I'm so sorry. Yeah, I would say most times it does work.
Okay.
But in terms of I can't think of a number. I would say the majority of the time. But it's important to note that for some people, they may still feel a little bit of contraction pain, or they may have one area that we call a window that doesn't get covered, or one side might be a little more numb than the other, and that's why we flip you like a rotisserie chicken. But I guess the good news is that if the first one doesn't work, we can always place a second one, but I know it's not always super fun. But for most folks, if you don't have scoliosis or any history of spine surgery, anything like that, usually the placement is easier. But it can be hard, especially when you're contracting and you're trying to get it in. And then sometimes it doesn't set up quick enough. So if you do have to, like, you're complete and your baby's ready to come out within 10 minutes, like that epidural might not have time to set up completely. So
That's why, like in here, I think it was like when you are in between 8 and 10 centimeters, they don't give it to you anymore because they feel like there's no time.
Yeah. Although I will say, I mean, a lot of times you can get it, especially if it's your first baby, because you might still be pushing for 2 or 3 hours. So I remember as an intern telling a patient that she was 8 centimeters and she couldn't have it. And the anesthesia resident, thankfully, overheard me. And he's like, Jen, it's her first baby. Shut up. Let's get her some pain control. I said, okay, we can. Absolutely. So I will oftentimes try, but if it's their second or third baby, right, and they're 8 centimeters, I'll be like, we can try. But sometimes as soon as you lay down the baby's coming out and you're like, okay, well, we gave it the old college try.
You know, for me, it was like I wanted to try without anything, and like they were keeping coming inside, like, oh, are you sure? Like, but which number of baby like you're having? You know, like it's my first. And I was like, are you sure? Oh, wow, you're very brave. You know, like everybody was like that, and I was like, okay, I'm starting to doubt about myself. Like, I'm not sure on this anymore. You know, because like everybody's pushing, like, I don't know, let me have my own opinion. Like, don't go there, because what I think, like many times what happened, like to many of us, that maybe we feel like we fail after birth.
Yeah. And it doesn't help when, you go in there and you're like, I'm going to do this without an epidural. And then 8 people are like, I don't know if you can. So then you get the epidural and then you think, well, maybe I could have. And that drives me nuts, because we can have babies without epidurals. People have done it for a long time, and it can be your first baby too. And, that's why it's really nice to, if you have a birth preferences or birth plan, which I include a copy in my book, but also on my website, you can go there and download it for free. You can specifically write down, like, as one of the top 3 things that are important to you is like, I want to go without an epidural. And if I want it, I will let you know. Please don't ask me. And that can also be something really great to ask your partner or your doula and be like, ma'am, we know what's available. Thank you. We will let you know, because there is also a difference between pain and suffering. And if you, like, I was unmedicated for my second, and it hurt a lot, but that was my plan. And that's what I wanted. It wasn't like I wanted an epidural and for some reason I wasn't getting it. And I was truly suffering, and I think that those of us who have done this work long enough, we can recognize the difference. And when somebody's on their path of like no epidural, like, you let me know. I know that you're going to, if you want it, you're going to let me know. So I'm sorry that they questioned you and you're just like, oh, just let me do this.
Yeah, just like, I went there, I want to do it this way. I had my birth plan, as to say, but I was told, like, listen, you have your birth plan, but like you need to be open-minded because it can change at any time. Like, which is something very important to be aware of, because that's when we think we fail because we didn't do as we wrote, right? But with my first one, what happened, it's like I was just with the gas, but at some point, like the midwife was like, okay, stop pushing. And then a doctor came in. I was like, okay, now I'm gonna cut. I'm gonna make a small cut in here to help the baby to get out, And I'm like, okay, that was what I had in my mind, like the only thing I didn't want, I was like, no, I don't want that. But I didn't have time for it, so I got the episiotomy because I was told after that the baby was in distress. It got stuck, and it was the only way to take him out.
Yeah. And sometimes that does happen. And I'm glad that they told you afterwards the story, because so many people, sometimes they're like, oh, your baby's here, it's fine. And you don't, or you leave and you're like obsessed with your baby, which is great, but you didn't ask the question of like, I don't understand why this happened or not. And it's true. Episiotomy sometimes can be an absolutely essential tool if a baby is not doing well and we really want your baby to come out. But it can also be overused. It used to be, what we did all the time. Yeah. And I say we, it wasn't me. Thankfully, it was an older generation. But it's hard if you weren't told like what the reason was, then you might leave wondering, did I really need that or not? And I think it's important, even if it does happen and you were told that you needed it, you can still feel kind of like, oh, I wish that didn't happen. Like, it's okay to have these feelings. It's why it's really important, if you are able to, is to know the people who are going to be there beforehand. So you feel like, okay, if they said I needed to do this, I trust them, as opposed to, I have no idea who this is. Like, I don't know. And it can be tricky sometimes. And I don't know how the healthcare system where you're particularly or where it's set up. But for us, it can be sometimes that people come in and never know the person they're having their baby with until that moment. And it can be hard to build that rapport when you have, no pants on and you're meeting them for the first time.
Yeah.
Yes. Yes.
Yeah.
And I think the beautiful message in your book is that you encourage women to ask questions, to also have a courage to say no, because many of us went through the process that we felt that we were violated, we were out of control. And I want to ask you how we can encourage more women to advocate for themselves in such a stressful moment of their life.
I know. It's so sad to hear everybody who like so many people clock in on that and they're like the fact that we're being told that it's okay for us to ask questions. Like it says something about our society where we have to
Yeah.
make sure that people know that. But when you think about especially as girls from a young age where we follow the rules and we're compliant and then you add in the power differential of like doctor and patient and you're supposed to, do what I say. So I think it actually starts way before you have you're there. You are raising your kids to know that they can say no. Consent starts with, when kids are young, asking if they want a hug or something like that. And especially when we're raising girls, to let them know that they're allowed to say no to these things and when they go to the doctor. And so I think it's so important. But if that wasn't how you were raised, like so many of us, this is a real moment to I hope going in, you feel like you're not crazy for wanting to know what's happening to you, like before somebody checks you or does a vaginal exam. And so I think just asking those questions before you even show up in labor and say, hey, if you say I need my cervix checked, I'd like you to explain why. And I'd like a moment to think about it. And if that person says, oh, well, I do them when I do them. That's how I practice. That gives you a moment of insight to be like, do I want to keep going with this person? Or do I now need to really make sure I have a doula? And you can ask these questions. So many of us are afraid to be impolite. You can still do it in a way that's not yelling at somebody and causing this. You can say, I'm curious if I have more time to think about this. Are there other options? Do we have a chance to wait? Do you mind if we talk privately and we'll ring the call button for you to come back in? And that shows like you're taking control, but it's not in a confrontational way. It just shows that you want things to happen with you, not to you.
Yeah, and I think this book is very helpful because it gives so many answers before you even go to the birth. So we highly recommend this book
Oh,
for
thank
any future
you.
mom.
Yeah.
I felt like you shouldn't require a medical degree to know the things that you can have a right to. So that was my goal, was like, I'm passing on these secrets. That shouldn't be a
Yes.
secret. So tell a friend so before you show it. So thank you. Yeah.
And you also mentioned before about the partners to be helpful, how they can prepare. Should they attend the class and how they should prepare to be useful in those stressful moments?
Yeah. It's so important. Partners, I mean, they contributed 50% of the DNA to this baby, right? So like they should be involved. And I think part of it is that, especially if folks are having a second child and their first was during COVID when they weren't allowed in the office or in the rooms, that's really hard. And I think we shouldn't have done that. So yes, partner, come to the visits, ask questions. I think sometimes, some of the men are too afraid, like, well, it's not my body, so I don't want to say something wrong, but it is okay to ask because it's your process too. And so be as informed as possible, go to the classes, read the books, ask your partner what she wants because everybody's different. She may say, I need you if they come in here asking about this, that's your job to answer it. Or she may say, I've got this covered. The only thing I want you to do is hold my hand and don't you look at my vagina when that baby's coming. Like whatever, just ask her. And then I think just don't be afraid to intervene. Again, it doesn't have to be in a confrontational way of, thank you so much. Do you mind just giving us like a couple of minutes? Because I just want to make sure that she's okay. And I think that should clue in that like you're here to support your partner for sure.
Yeah, it's important to have that advocacy from them. And like you said, during COVID, we both gave a birth during COVID, and it wasn't great. Yeah, without them all through all the process.
Right. Like I remember like not being there at the ultrasound. So like they'd be filming the ultrasound while the guy's in the car outside. I'm like, you guys, come on. Like this just said that they're not essential. And I think they're so essential. Like
True.
the amount of trauma that we see. Yeah. Anyway, so let's knock on wood that doesn't happen again.
Definitely.
Yeah, but the funny thing, my husband, he couldn't come with me to the public one, but then we booked in a private clinic for him to come with me and see the baby because it was like, okay, I think it's fair, like that we go both together. Want him to see it as well, to hear the heartbeat, and like it was nice. But as you say, it wasn't just like before giving birth. After giving birth, first night in the hospital, I was by myself because he couldn't stay.
Oh my God. Yeah, that's true. Yeah. And so as if it's not hard enough to birth a human and
Yeah.
you have to like feed them and all this stuff, and then your partner, that makes me so sad.
Yeah, and I got a kind of a reaction in the hands, like red hands, like very itchy. And when I was standing up, I was fainting. And they didn't know what was it. So I was there in bed with the baby, trying to clean the baby however I could, But I was lucky, like, there was very nice midwives, but, it was
Yeah.
very hard.
No. Yeah, I know. Oh.
We talk about that permission, like as Jules was saying, about saying no to things, right? And I think, I don't remember if it was in the book or in one of the videos that I saw on TikTok about the sweep, when you are pregnant but you are overdue, right? And I didn't know that you can choose if you want that, because I was 41 weeks with both of my kids, so I had them both done. And I saw that so many people, they had like a lot of or pains or cramps or whatever was it. I had the date like to induce the birth of the babies, both of them, but after the sweep, like they came out 1 or 2 days after. Like it worked for me, but I didn't know all the things that could happen.
And that makes me so sad because we have a choice. Like we know when we go to a restaurant, we choose what we want. We can say, I don't want tomatoes on my burger, or I want ketchup or ranch dressing. And then we go to the doctor's office and we just think that, okay, I'm going to sweep your membranes. And so many of us don't think like, well, do I have a choice? And that's not because that people aren't smart. It's because it's presented in that, well, this is what we do at 41 weeks, or we check your cervix, or they're not told and they think they're just getting a cervical exam and they're getting a membrane sweep. And it just makes me so angry. I mean, I'm laughing, but I just, I want to like punch somebody. But it's also, as I was writing this book, I wanted this book to also be, and I hope that other OB-GYNs and midwives will read it to understand the perspective of what patients, their perspectives are, what's going on, and that we need to stop telling people what to do with their bodies. Just like you wouldn't go get your hair cut and just sit down and say, do what you want. Like you would, there's an interaction and you tell people what you want. Because yeah, membrane sweeps has great data behind it, right? When it comes to helping labor along, but it should only be done like anything to your body after it's explained and you have full informed consent. And sometimes I have a hard time understanding that these things happen because I practice with great people, great nurses. I'm in a part of the country where I feel like we do it really well. But being on social media, hearing stories, that's a lot of why I would cover some of these things in my book, because I would think, well, doesn't everybody know that? Like, who would do that? And then I get these messages of what happened, and it breaks my heart because people don't know that they have a right to say no, or that this shouldn't happen. And so I can't, this book is not going to change somebody I'm never going to meet who's going to practice maybe in a week, but maybe it'll start changing the culture of people going in and saying, I know what I have a right to, and I need you to explain this to me, which is a sad statement on society if we're still telling people like, you get to decide what happens to your body, right? Especially something as intimate or, something like a membrane sweep or a vaginal exam.
Yeah, I think it's very important. Like, I mean, like, it's going to change. Like, we needed this before, even with COVID and everything, was very hard, like, to find out all those things by ourselves. I wanted to go with the IUD inserts because that's another thing. Like, I didn't hear about, or at least we don't talk about contraceptions till the 6 weeks postpartum visit to the doctor, right? And I don't know, I found out with your book, like it can be inserted just after you give birth or even when you gave birth, right?
Yeah, it's kind of crazy but fun when we do it right after you have your baby because it's so this is called a post-placental IUD insertion, and it's what it sounds like. The data says we're supposed to put it in within 10 minutes of the placenta coming out. before, as the uterus is shrinking down. And we can place it in between our fingers and go up, or use a grasper and put it up. Now, the caveat is that there's a higher risk that it's something called expulsion, or that it will fall out on its own. But when you look at the percentage of women who won't actually show up for their 6-week visit, and this is based on US data, since so many don't, the amount of IUDs that stay in place, even with the increased expulsion rate at 6 weeks, compared to people who come back at 6 weeks to insert it, the rate is higher for people who get it right at the time of having their baby, because they're there and they're getting it done. So I think it's a great option for people who might otherwise be afraid to come in for an insertion, or they might not come back for their 6-week. Or this was a huge issue when I was in training. People were losing their health insurance within just like a couple weeks after having their baby. So even if they came back for that 6-week, it wouldn't be covered, and it would cost like $1,000, which is a wonderful, uniquely American problem. However, we have increased postpartum coverage, so that's not as bad, but it's insane and it's crazy. And in some ways it's just funny because you place it and you're like, hope it stays, this big uterus, but it usually does, and we could use an ultrasound. But it's a great option. And this sounds really sad, but there are some people who have their lives controlled by their partners, and their partners don't want them to have contraception or won't let them come back to the doctor. And I've had some situations where that post-placental IUD was the only way, and she wanted contraception, the only way that we could get her something without being controlled, which was a whole problem in and of itself. And, we did our best, but it's just more options are better, I think, and it might not be the right choice for everybody, but for some people it is. So.
Yeah, but I think we are not informed. We don't know much about it, because you don't know if you have to be on your period when you go to insert it, how much pain you're gonna have, how long it's gonna take, all those things. And then I inserted mine after I had my second kid, and they told me it's okay, it's valid in between 3 and 5 years. And I was like, okay, but in between 3 and 5, it's a kind of big window. You mean if I wait more
usually
than 3?
You're just supposed to have one. Yeah, that's an interesting range. And
Yeah. So after 3 years, I was there, okay, I want to change.
Like today, I know. And I think there's also so much misinformation about IUDs on social media. But again, it also comes back to us as well as physicians, because you will see some who still say, oh, you have to be on your period. You don't. Or they'll say you have to do that. And it's just extra hoops that people have to jump through. And then they're not as trusting because they're like, well, why are you saying that when I read it over here that it's not true? Or they may not offer pain control. I've had multiple IUDs now. I will probably be buried with one in my uterus because I love it so much. And I remember I had them placed at my 6-week postpartum visit. And for folks who are considering one, that is a nice time to do it because your cervix, it's still, it's not, you've had a baby vaginally, and even if you've labored. I remember holding my baby the second time, and he was like nursing as she put it in. And I was like, oh, let me know when it's done. And she's like, it's in. I was like, oh God, should I be worried that I felt nothing down there? I don't know. But it's just not even know what to ask for. I know. I was like, are you sure it's in? She's like, Jen, I promise you.
But you always feel like it's still in position, like maybe it moved. Is it working?
I know. I just think they're magic. I just think they're just magical. And for me, the thing that I love is the not having a period, because I haven't had a period since Barack Obama was president, and I love it.
Oh, that's nice. That's a hormonal, right?
Yes, yeah. The non-hormonal one does not do the same.
Although
I will say,
mm-hmm.
Which is again, more options are always better. It depends what you want, but yeah.
That's true. But it's also I'm so surprised that there's so many people not coming to that 6 weeks after postpartum checkup. But I understand about the insurance and all that. Here in Germany, it would be like you can't think of it not to go.
Oh my
So
God!
it's crazy. How is it different in?
It's so different. But I'll tell you, another big part of it too is that so many women go back to work even before 6 weeks because they can't afford. There's no paid leave here. So they go back to work and they're juggling a kid. It is a huge. Oh God, don't get me started. But then they'll say, "Oh my gosh, you're a socialist." I'm like, it seems to work for health insurance. Like, why are we so far behind? But yeah, I don't know. And I think that the other problem too is that we're such a huge country. 30% of our counties have no OB-GYN, midwife, labor and delivery, or birth center. 50% of counties have no OB-GYN. So imagine you just had your baby and you have to travel like an hour and a half to go see
my
your doctor.
goodness.
Like, you're not going to go, especially if you've got more than one kid. And so you just, you think everything's okay, or you'll make a visit if something's wrong, and then you might end up pregnant and you didn't want to. So,
Yeah.
mhm.
It gives a huge perspective, because here we complain in Germany that we have a 1 year of 67% paid
Mhm.
maternity leave. And we are like, no, we want to have 100%. I'm originally
Yeah.
from Poland, and we have 100% back in Poland for 1 year.
Yeah.
And we're still like, oh
Yeah.
my goodness, we should stay at home for 3 years, but
I know.
we
I
can't have
know.
everything.
I know.
We
And
shouldn't
here
be
in the US,
complaining.
we're like, can we get some insurance for this Tylenol cover? Could we just get a vaccine, please?
It's crazy.
Yeah, I laugh, but it's what's sad is so I'm in Oregon, and so not super close to Canada, but we'll get people who come down from Vancouver especially, and they're like, yeah, I had my first baby in Canada and I had a full 52 weeks paid leave and all this. I'm
Yeah.
like, why are you here? Like, go back.
Go back. Yeah.
I know. Oh man.
But Dr. Lincoln, before we finish, could you tell our viewers where they can find you and where they can purchase your book?
Yeah, so you can find me on social media, all the channels at Dr. Jennifer Lincoln. It's Dr. Jennifer Lincoln. And also my website is drjenniferlincoln.com. You can order my book wherever you get books. If you are more of an audio book
Amazon.
person, yes, Amazon, get it
Amazon, yeah.
there.
Very
And
fast.
please leave a review, because the reviews help. But you can also, I narrated the audiobook, and you can also do Kindle, so it's there. And if you do have the book and you want those resources or not, and you want them to, you can go to my website. There's all these free resources of checklists and protocols and birth plans. And last but not least, my podcast, Let's Talk About Birth. It's a limited 10-episode series all about birth, and there's some people on there I think you'll recognize, some from social media, and then other folks where we just every week we talk about a different thing, and it's been really fun to roll out with the book. So yeah, would love to have you follow along.
Yes, definitely. Thank you so much for your time and this wonderful book. I can't praise it enough.
Oh, thank
And
you.
yeah, thank you for coming to our podcast.
Thank you
Thanks for
so
having
much.
me.
Okay, so I hope you like this episode and you know where to go get it.
Yes, this book is amazing, especially for the first-time mom or any mom to be. Go ahead and check this book out. We recommend it.
Remember to follow us on all the socials.
Yes, comment, like, subscribe on our YouTube channel, and let us know what do you think.
Take care.
Be kind to yourself.
Till next time.
Bye.
Bye.